Hello everyone, welcome to our YouTube channel Logic Medico. Today interesting topic is tumors of the oral cavity. Tumors of the oral cavity can be of two types, a benign tumor and a malignant tumor. A benign tumor is a self-limiting tumor, small in size, it spreads to a lesser extent. A malignant tumor on the other hand is a more dangerous type of tumor in which it spreads rapidly, it metastasizes to various organs like liver, kidney, brain, eyeball, heart, lungs, various important organ, and the person dies as early as possible. So that is a malignant tumor. So both types of tumors are possible in the oral cavity. Based on the tissue of origin, it's basically classified into 5 types. So what are the 5 types? Tumors arising from the epithelium, the mucosal lining of the oral cavity, the red color mucous membrane, it can arise from there. It is called the stratified squamous epithelium. We all know that. Tumors can arise from the underlying connective tissue. Just underneath the mucous membrane, the red carpet, we have connective tissue which holds the mucous membrane onto the underlying muscle. So tumor can also arise from the muscle which is there in the tongue, soft palate, cheek, all these places. Also muscular tissue tumor. These muscles are controlled by nerves. Both the mucous membrane also. Sensation, we have hot, cold tea. If you drink, you feel the sensation, right? Hot tea or cold tea. Also taste, you feel the taste, various types of taste, salt, spicy, sweet, sour, bitter. So these taste, sensation and general sensation is controlled by nerve, including the muscles. Muscles motor control is also by nerve. So tumor can also arise from the nervous tissue. Last but not the least, metastatic tumors of the jaw, especially the tumor is somewhere else. It is there in the liver, it is there in the pancreas, in the abdomen. It will spread to the jaw, that is a mandible. So that is called metastatic tumor of the jaw. Moving on to the most common tumor. Before moving on to that, the most common tumor affecting the oral cavity is tumor of the epithelium. Sir, why is the tumor of the epithelium is most common? Because we are eating not only food, but various people have got various habit of eating pan, gutka, smoking. So all these irritants which are available, more than 5,000 chemicals are there in this substance abuse. So they will irritate which part? Will it irritate the muscle, the nerve, connective tissue which are deep, or the superficially lying epithelium? I believe you would have guessed it. It is the epithelium. So the most common tumor of the oral cavity, you must have seen in some cigarette packet or gutka packet, they would have given one dangerously visible photograph, that is of a carcinoma of oral cavity. It's mainly of epithelium. So we will do in detail about the epithelial tumors. Other tumors are rare. For completion purpose, I will just tell you the name of that. Okay, tumors arising from the epithelium of the oral cavity. The most common tumor is the Squamous Papilloma. This is a benign tumor. First I will teach the benign tumor, subsequently I will teach the malignant tumor. What is benign? I already told you. Benign is self-limiting tumor. Small tumor, as you can say. Metastasis is rare, but possible, but rare. So first tumor is Squamous Papilloma. As the name suggests, it has got finger-like projections, the tumor presentation in the mucous membrane. It is caused by papilloma virus. Human papilloma virus number 6 and 11 are most common virus. Initially it will cause epithelial hyperplasia, meaning increase in the number of cells. When the cells are increased, it will project like a polyp, or what we can tell, like a grape like projection in the mucous membrane. The most common location within the oral cavity is the Squamous Papilloma of the lip. It is a pedunculated tumor, means it has got a stalk, and thankfully it is a painless tumor. So patient will wait until it gets infected and pain comes, then only they visit the doctor. It can be small also, numerous means many in number. It's a finger-like projection. I already told you papilloma means finger-like projections. Treatment is surgical excision from the base, including the base of the mucosa, to prevent the recurrence. Meaning, if you don't remove the base, it will come back again. Okay. That is the first tumor, Squamous Papilloma. Moving on to the next, Keratoacanthoma. The main etiological factor of keratoacanthoma is exposure to sunlight. Other factors includes exposure to chemical carcinogens, so many chemicals we are eating, preservatives and all, that one. Trauma to the oral cavity either by dentures or by the tooth brush, or by the fingers, nails, human papilloma virus, genetic factors, and immunocompromised state of the individual, that is HIV positive status. This occurs in keratoacanthoma I'm talking. This occurs in fair skinned individual, that is occurrence. Location more commonly in face and necks. In oral cavity it is in lip. Again, it is a solitary, means single. It is an elevated lesion. It is umbilicated, like our umbilicus, it is depressed. In abdomen we have one depression, no? Like that, umbilicated with a central core, depressed central core. That is the meaning of that. Treatment, again surgical excision. Next, oral nevi. Also, what is oral nevi? It is a benign proliferation of the nevus cells. So these cells are present in epithelium. It's a benign proliferation of that. Usually most of the patients are asymptomatic. If they present symptom, usually they have a pigmented brown patch or a blue or black patch. It's a well circumscribed. The patch will later get raised. It forms raised lesions. Okay. The blue nevus is one of the variety of this oral lesions, more commonly found on the palate. Again, the treatment is surgical excision of this blue nevus. Moving on to the malignant lesions of the epithelium, which is more often than not with which the patient presents to the hospital. The first tumor among this is basal cell carcinoma. As the name suggests, in stratified squamous epithelium we have something called stratum basal, the basalmost cells, columnar cells. It arises from that. That's why it's called basal cell carcinoma. The etiological factors mainly is exposure to UV light, that is sunlight, chronic sunlight exposure. Some individuals are working in high-rise buildings. They are exposed to direct sun rays, especially their lips, the mucosal junction. Some individuals working, other etiological factors are they are working in radiology department, exposure to radiations like X-rays. Clinically, lightly elevated papules, they are like acne, okay, within the oral cavity with a central depression like umbilicus. Later it ulcerates, it bleeds, okay. Then it heals, again it ulcerates and bleeds again and again. So this is a classical sign, especially in face it will be there, but more often than not in the lip also it can be there. It appears like some rodent had made a depression, so it's also called rodent ulcer. Mild trauma can cause bleeding easily, okay. Smaller lesions, treatment is surgical excision. Larger lesions in addition to surgery, that is a radical surgery, means excision of more than what is required. In addition to that, radiation therapy, that is exposure to X-rays. Moving on to the next carcinoma, squamous cell carcinoma. Tobacco in any form is a main etiology for this. If anybody are consuming tobacco, one or the other day they will end up in squamous cell carcinoma, including smokeless tobacco or whatever it is, pan, gutka, cigarette, bidi, whatever it is, any form, especially when it is coupled with alcohol, it's a double-edged sword. Okay, tobacco also causes squamous cell carcinoma, alcohol also causes. If both are consumed, it will occur, instead of occurring at 40 years, it will come at 30 years only. High exposure to UV radiation is another cause. Leukoplakia, a white patch within the oral cavity, is another etiological factor. Poor oral hygiene, dental hygiene and oral hygiene, mucosa, cheek, gums and all, poor hygiene. Low dietary intake of vitamin A and C. Inadequate consumption of fruits and vegetables, because they contain antioxidants, fruits and vegetables. If you don't consume that, obviously no antioxidants, so everything is destroyed within the oral cavity, resulting in squamous cell carcinoma. Clinical feature, a classical cauliflower-like growth will be there. This cauliflower will bleed and ulcerate in the center, producing an exophatic proliferative growth. Treatment depends on the stage, mainly surgical excision, also radiation therapy. But it mainly depends on the stage, how much surgery has to be done, how much radiotherapy has to be given. So radical surgery and radiation therapy. Moving on to the next carcinoma, it is Varicose Carcinoma. The lesions more occur in gingiva, that is in the gums, may grow into the soft tissue and invade and destroy them, including the underlying bone, especially the teeth or the jaw bone. Regional lymph nodes are also enlarged and tender. So in this case, in addition to surgical excision, we have to do lymph nodectomy, meaning removal of the regional lymph nodes in the metastatic area. Lymph node excision also has to be done in addition to surgical excision. Okay. Moving on to the next tumor, malignant melanoma. Everybody of us has got melanocytes. These are the pigment producing cells. Okay. The tumors arising from these melanoma cells or melanocytes are called as malignant melanoma. Melanocytes, pigment producing cell. Everyone have got one color, no? That is because of melanocytes. So the tumor arising from melanocytes or melanoma cells is called as malignant melanoma. The main etiological factor is environmental factor. Again, sun is the main cause. Sun exposure, UV, artificial UV light. Some of the factories and all use UV light for workers, so they should use some protective measures, clothings. Otherwise, they'll end up in malignant. It's the most dreaded carcinoma, malignant melanoma. Socioeconomic status, low socioeconomic status, fair skin individuals and red hair individuals are more prone, that is racial features. Genetic factors, familial melanoma, xeroderma pigmentosa is a genetic abnormality where they don't have any pigment. The entire individual appears like a white, like similar to a milky color individuals. So those are prone for malignant melanoma. Risk factors of oral melanoma is actually not known because sun rays, how it enters into the oral cavity, nobody knows that. What happens in the clinical feature, more will be there, some birthmark will be there, okay. That birthmark, if suddenly increases in size, suddenly the birthmark changes its color, suddenly it becomes nodular, like multiple acne within that, suddenly it starts bleeding, ulceration, then we should be careful, that can be a malignant melanoma. Treatment mainly depends on surgical excision, and most of the patients, only some 5 to 10% patient will recover because it's the most dreaded carcinoma, malignant melanoma. Moving on to the tumors of the connective tissue. Fibroma, tumor, it is a tumor arising from connective tissue fibers underlying the mucous membrane. It's called fibroma. Lipoma, it is a tumor arising from adipocyte, lipocyte, the fat storing cell. Okay, lobular pattern is there. It appears like some mouse is underneath the carpet. We can make out, right? So like that, under the carpet is red color, mucous membrane. Underneath that, some mouse is moving. Like that, it appears. Lipoma. Next, hemangioma. This is an interesting tumor arising from the blood vessel, especially capillaries. Hemangio, hema means blood, angio, blood vessel, angioma, oma means tumor, blood vessel. Interesting in these tumors, when you press, it will disappear. I mean, the size of the tumor will reduce or disappear. When you release your finger, it will come back. Why is that? You can think, it's mainly because when you press on the tumor, the blood will empty from the tumor. Tumor cells are a complex network of noodles will be there, like one noodles. If you press the noodle, the interior of the noodles is filled with blood, so the blood will get disturbed. I mean, it will get displaced. So when you release your finger, there is no pressure. Again, it will get filled. Interesting symptom. Treatment: careful surgical excision from the surrounding connective tissue. Otherwise, the person will have severe bleeding and they will die in a OT table. Lymphangioma is similar tumor arising from lymphatic capillaries. Lymph is a transparent fluid. So arising from lymphatic capillaries, it's called lymphangioma. It's rare but possible in the oral cavity. It's mainly common in the neck. Okay. Numerous dilated lymphatic vessels are seen, lined by a single layer of endothelium cell and it's filled with lymph. Again, this tumor also, this is pinkish or purplish in color. This is whitish in color, lymphangioma. If you press, again it disappears, and if you release your finger, it will come back. The tumor. Chondroblastoma is a tumor arising from chondroblast or the cartilaginous cells of the mandible. Osteoma is a tumor, benign tumor arising from the jaw, that is the lower jaw mandible or the upper jaw maxilla. Tumor arising from the muscular tissue is called myoma. It's rare but possible within the tongue. Second possibility in the soft palate. Again, treatment is surgical excision. It appears like there is one swelling in the tongue and swelling in the soft palate. You have to remove those swellings. Surgical excision. It's rare but possible. Tumors of the muscular tissue, myoma. Last but not the least, tumors of the nervous tissue is very painful. Initially it is painless. Once the tumor presses on the axons of the nerve ending, then it will become painful. It's called the neuroma. If it arises from Schwann cell, we call it as schwannoma. If it arises from the neural enamel sheath, we call it as neuroma. Initially it is painless, as I told. Subsequently, when it compresses the nerve, tingling and numbness will be there, like jim, like the sensation will be there, some tingling, numbness, like woody sensation will be there in the tongue. Suddenly the taste sensation will be lost because the nerve is getting damaged, right? So subsequently the patient will have severe pain. All these are symptoms of that. Again, treatment is surgical excision of this tumor with radiation therapy. Thank you for watching and learning from Logic Medico. Kindly subscribe to our channel and press the bell icon, and don't forget to press the thumbs up icon. Thank you once again.